Today we're going to demonstrate a medial femoral condyle MACI Arthro technique. Again, this will be slightly more truncated than our previous techniques. You can see we prepared the defects as the medial femoral condyle. And again, we're just going to show how to put the cutter in one more time, our final check. Again, go into the notch, keep the leg at 90 degrees. We're going to check with that cutter. Again, the key here is to see that outer area. It can be hard sometimes to see, so you want to make sure you can see the scope from all the angles. We have our cannula placed in there. This is one of the smaller cutters. And again, we do a slight wiggle of the cutter to make sure we can check all the edges. This is a small hand curette. We're going to clean up the edges to make sure we have nice borders. You can see it's completely enclosed. There is no blowout on any side. And now what we're going to do is dry the knee. We've taken all the fluid off. We've taken the tourniquet down. And then we're going to make sure there's no active bleeding. There's a little bit of bleeding here, so we're going to use gel thrombin. These are large patties to make them easy to retrieve out of the knee. And again, we're going through the cannula. We've removed the dam from the cannula. We're going to use the V-shuttle again to do a test run. Again, you can sometimes see that it's not a completely perpendicular entry. So here we're going to put some Tacil on here. And now what we're going to do is place the graft. You can see on previous videos the entire technique. And then we're going to use the other tip. Now again, be careful here. You can see even in my situation, I pulled it down a little more than I wanted because the Tacil may not have been fully set. And then you're just going to be really careful, again, just small touches of this graft. The cell side down now. And then you wait for the 3 minutes, and then you're going to place some more Tacil. Again, it's much harder to go from bottom to top, so you always want to start at the top. And then use the knee to your advantage. Now we've waited 6 minutes total. And we're going to go up and down and check to make sure the graft does not come off. You can see here the graft does not come off with full range of motion, and we're really happy with this. There's the final product. Thank you.